Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Well, good morning, everyone, or good afternoon, good evening, wherever you are. So I'm going to start off with talking about biomarker testing, the key fundamentals and challenges in biomarker testing. Here are my disclosures. And so the topic of my talk today is biomarker testing, and I'm going to be first talking about the key biomarkers that we test for patients diagnosed with non-small cell lung cancer. Subsequently, also talking about the current standards in biomarker testing and also the barriers and challenges to biomarker testing. So the first question is, what is a biomarker? A biomarker is any gene, protein, or any other substance that can provide us more information about cancer. As you see here from this snippet, each cancer cell has a specific DNA, and the mutations or any particular proteins that are overexpressed, which are sort of cancer-causing genes or proteins, are really, what we call biomarkers from a treatment standpoint. From non-small cell lung cancer standpoint, there are a variety of biomarkers. Each person's cancer has a unique pattern of biomarkers, and knowing this is important specifically for non-small cell lung cancer because it may affect how certain cancer treatments work and may help choose the right cancer treatment for each patient. When we talk about biomarkers for non-small cell lung cancer, I like to think of two key sort of buckets of biomarkers which are important. One is essentially the immunotherapy biomarkers, which help us to select immunotherapies for our patients. Typically, we think about anti-tumor immunity through the T cells and then the tumor cells. Certain tumor cells may express a protein called PD-L1, which can actually inhibit the immune response, resulting in tumor growth. And so this protein is very important because also the immunotherapies that we have today work through this mechanism by inhibiting this inhibition of our anti-tumor immunity and subsequently sort of priming our immune system for anti-cancer properties. And the way we measure PD-L1 levels, which serves as an important biomarker, specifically when we talk about immunotherapy, is through looking at the pathology under the microscope from the tissue biopsy, and essentially through various staining techniques, trying to calculate the percentage of cells which actually express PD-L1. And compare that to the total number of tumor cells and come up with a number which is sort of ranging from 0 to 100%. The more the PD-L1 percentage, the higher the likelihood in general, the higher the likelihood for response to immunotherapy from the tumor standpoint. The other important biomarker, and you're going to hear a lot about this today, is basically the driver alterations, meaning that the alterations in a particular tumor cells which are driving cancer and tumor growth. As you know, all cells will have DNA, which is generally non-mutated. When cells acquire DNA alterations, there may be tumor formation. Now, the alterations in the DNA can occur in a variety of flavors, so to speak. It can be an activating mutation when a mutated DNA can downstream lead to an activated protein and increased activity. This is the case when we talk about non-small cell lung cancer. This is the case for KRAS G12C, EGFR, and other mutated non-small cell lung cancer tumors. The other variety of driver alteration is fusions, essentially leading to fusion of one gene to another, causing a fusion protein, which can drive tumor growth. This is what we find in ALK and ROS and RET, so some of the fusion-driven non-small cell lung cancers. And finally, there may be also gene amplifications where there's a variety of genes that may have many more copies of the gene than normal, leading to increased protein activity and uncontrolled cell growth. When we talk about non-small cell lung cancer today, there are a variety of driver mutations that we would check for, given that if there is a presence of a driver mutation identified on a non-small cell lung cancer tumor specimen, we would think that it may be more responsive to particular targeted treatment if we have one to that particular driver mutation. Here is the prevalence of driver mutations found in lung adenocarcinoma. As you see, KRAS and EGFR are sort of the most common ones, but also frequently we would find ALK-ROS1, BRAF, HER2, and others, which we will be talking about in later sessions today.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly and Exelixis. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.